Fatty liver, causes, symptoms. Welcome to Health Life Channel. Fatty liver disease, FLD, means you have extra fat in your liver. You might hear your doctor call it hepatic steatosis. Most of the time, it doesn't cause symptoms. Drinking a lot of alcohol can make you more likely to get one type of fatty liver disease. Over time, too much alcohol leads to a buildup of fat inside your liver cells. This makes it harder for your liver to work. The good news is you can prevent or stop FLD with lifestyle changes. Fatty liver disease types. 1. Non-alcoholic fatty liver disease, NAFLD. This type is very common in the U.S., affecting 1 in 3 adults. Researchers aren't exactly sure what causes it, but obesity and diabetes will increase your risk of getting it. Unlike the other main type, you don't get it from drinking alcohol. There are 2 forms of NAFLD. Simple fatty liver. This means you have fat in your liver, but you may not have any inflammation in your liver or damage to your liver cells. It usually doesn't get worse or cause problems with your liver. Most people with NAFLD have simple fatty liver. Non-alcoholic steatohepatitis, NASH. This is much more serious than simple fatty liver. NASH means you have inflammation in your liver. The inflammation and liver cell damage that happen with NASH can cause serious problems such as fibrosis and cirrhosis, which are types of liver scarring and liver cancer. These problems can lead to liver failure and require a liver transplant. About 20% of people with NAFLD have NASH. 2. Alcohol-related fatty liver disease, ALD. This type is less common, affecting about 5% of people living in the U.S., and is caused by drinking alcohol. For this reason, it usually gets better when you stop drinking alcohol. If you keep drinking, ALD can cause serious problems. These include enlarged liver. It doesn't always cause symptoms, but you may have pain or discomfort on the upper right side of your belly. Alcoholic hepatitis. This is swelling in the liver that can cause fever, nausea, vomiting, belly pain, and jaundice. Yellowish skin and eyes. Alcoholic cirrhosis. This is a buildup of scar tissue in your liver. It can cause the same symptoms as alcoholic hepatitis, plus large amounts of fluid buildup in your belly. The doctor will call it ascites. High blood pressure in the liver, bleeding in your body, confusion, and changes in behavior. Enlarged spleen, a small organ inside your rib cage that's part of your immune system. Liver failure, which can be fatal. Alcohol-related fatty liver disease usually comes first. It can then get worse and become alcoholic hepatitis. Over time, it may turn into alcoholic cirrhosis. If you drink heavily, talk with your doctor. It's confidential, and they can help you get your drinking under control to save your health. Fatty liver disease symptoms. With ALD and NAFLD, there are usually no symptoms. Some people may have signs such as tiredness or pain in the upper right side of the belly where your liver is. If you have NASH or get cirrhosis, you may have symptoms such as swollen belly, enlarged blood vessels underneath your skin, larger than normal breasts in men, red palms, skin and eyes that appear yellowish due to a condition called jaundice, nausea, weight loss, or loss of appetite, tiredness, or mental confusion. Fatty liver disease risk factors. For ALD, the cause is too much alcohol. You may be even more likely to get it if you drink a lot and are obese, are malnourished, have chronic viral hepatitis, especially hepatitis C, are an African American or Hispanic male, or have male anatomy, are female, or have female anatomy, because of the way alcohol is processed in women, are older. The older you are, the more likely it becomes. The reason why some people with NAFLD have simple fatty liver and others get NASH isn't known. Genes may be a reason. NAFLD or NASH is more likely if you have obesity or are overweight, your body doesn't respond to insulin as it should, called insulin resistance, or if you have type 2 diabetes. You're older. You have polycystic ovary syndrome. You have sleep apnea. You have an underactive thyroid. The doctor will call this hypothyroidism. You have an underactive pituitary gland. You'll hear this called hypopituitarism. You're malnourished. You've lost weight rapidly. You've been exposed to certain toxins and chemicals. Fatty liver disease in children. About 10% of children in the U.S. have NAFLD, and numbers are growing as the number of obese kids grows. NAFLD is also more common in older children rather than younger children, Hispanic and Asian American children rather than white and African American children, least common, boys rather than girls, though it's equally common among children with NASH. But most children with NAFLD don't get liver problems, and NAFLD can be controlled or reversed if your child changes their lifestyle and eating habits. Fatty liver disease diagnosis. Because most people don't have symptoms, these conditions aren't easy to diagnose. Your doctor may use different methods to find out if you have fatty liver disease. Some of the things your doctor may use to diagnose fatty liver disease are health history and physical exam. Your doctor will ask about your alcohol use. This information can help your doctor tell if you have ALD or NAFLD, so be truthful. They'll also ask about medications you take, how you eat, and other health conditions you might have. Your doctor will also check your body for signs of liver problems, such as an enlarged liver or jaundice. Check your height and weight to calculate your body mass index. BMI. Your BMI determines how much you should weigh based on your height. Blood tests. Your doctor may order the following blood tests. Other blood tests to rule out other causes of FLD, like tests for hepatitis C and Wilson disease, a rare genetic condition. Hemoglobin A1C, which shows how stable your blood sugar is. Fibrosis assessment tests to estimate your level of liver scarring, fibrosis. These blood tests result in a score that estimates your level of liver scarring or fibrosis. Imaging tests. You may get an ultrasound, computerized tomography, CT scans, or magnetic resonance imaging, MRIs. These tests can show if there's any fat in your liver, but they can't tell whether you have simple fatty liver or NASH. There are some tests that can show whether you have fibrosis by measuring the stiffness of your liver. When liver cells die, they're replaced by scar tissue, which is stiff. The stiffer your liver is, the more scarring it has. Transient elastography measures liver stiffness using a special ultrasound machine. Magnetic resonance elastography, MRE, combines ultrasound and MRI to create a visual map of stiffness throughout your liver. Liver biopsy. Not everyone with NAFLD needs to have a liver biopsy. Your doctor may recommend it if you're at risk for NASH, or if other tests show that you may have NASH complications, such as cirrhosis. A doctor removes a sample of tissue from your liver and sends it to a lab to see if you have liver inflammation or damage. You'll get this done at a hospital or outpatient surgery center. Before the procedure, you'll get medicine to help you relax or control pain. For the biopsy, your doctor numbs the area and uses a special needle to take a small piece of tissue from your liver. A liver biopsy is the only way for doctors to diagnose NASH.